Is it possible for dementia by itself to cause someone's death?
I just want to be clear. So the term dementia is sort of an umbrella term.
Okay.
It's like if you sort of talk about like a headache, right? A headache, might be from something that's not very serious, like a migraine headache or a muscle tension headache or something like that. But a headache could also be from something very serious like a stroke or a brain tumor. Mm-hmm. And so with dementia, it's the same sort of way. So you can actually have dementia from something as mild and easily treatable as a vitamin deficiency or a thyroid disorder. But then, of course, you can also have dementia from a variety of different disorders, including some of the ones that we talked about, like Alzheimer's disease, vascular dementia, chronic traumatic encephalopathy, this dementia with Lewy bodies. Those are all different causes of dementia. And so if the dementia is caused by, one of these common underlying brain diseases like Alzheimer's, then absolutely the cause of the dementia can also be the cause of death. But the way that I sort of think about it is it's like Alzheimer's disease that's causing the death. It's that. So the answer is yes, a dementia can be the cause of someone's death. I would just always, as someone who specializes in this, refer to it by, the underlying cause. So the Alzheimer's disease, the strokes, if it's vascular dementia, dementia with Lewy bodies, chronic traumatic encephalopathy, frontotemporal dementia, whatever it is.
Okay, that makes sense.
I'd just like to make a comment about that as well. Sometimes people go to the doctor and with these concerns about thinking, memory, maybe word finding, maybe getting lost, and the doctor says, I know what you have. You have dementia. I think you should go back to the doctor and say, Doctor, thank you for explaining that I have dementia, but please tell me, what is the cause of my dementia? What disease is causing it? Because dementia itself is not a disease. It would sort of be like if you went to the doctor and you said, Doctor, I've got this pain in my head. And the doctor said, I know just what you have. You have a headache. That's what you have. Now, right, you're laughing because that would be ludicrous, right? You wouldn't be satisfied being told by the doctor that you have a headache. You'd want to know, well, that's fine, doctor, but what is causing the headache? And if a doctor gives you a diagnosis of dementia, you got to go back to that doctor and say, that's good. I'm glad you understand, my symptoms, but I want to know what's causing it. If the doctor can't give you an answer to that, you need to see another doctor.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.